Welcome to National Health Transport's Physician Certification Statement, or PCS Training. Today's training is led by Roy Troutman. Roy is an EMT for over 10 years and is a certified ambulance coder. Roy specializes in physician certification statement and documentation training.
We're going to go over a PCS. A PCS is a physician certification statement. PCSs need to be obtained on all of our non-emergency and our inter-facility transports. The best way to think of this, if you're taking a patient out of the hospital for any reason, you need one of these in your hand. The PCS, Section 1 is the top portion. This is the only section you as a crew member are allowed to fill out. So what we need here, we need the patient's name, their date of birth. It says Medicare number, but basically we need a Medicare number or some type of insurance number. We basically need something that we can use to verify that this goes back to that patient. We need the transport date to be written in. We need the origin location, and we need the destination. Anything below the locations, only fill out if you 100% know the answer to it. So the first question about Medicare Part A, yes or no? Most likely you are never going to know the answer to that question if the patient is covered under Medicare Part A. So if you don't know that answer, leave it blank. The next thing, is the patient going to the closest appropriate facility? Yes or no? The only time the patient would not be going to the closest appropriate facility is if you're transporting a patient a distance that you're going to be passing other hospitals or care centers that patient could be treated at, but they're going somewhere further for a higher level of care. The way to think of closeness in this aspect is if you're transporting a patient out of the hospital to a nursing home, just because there's a nursing home right beside the facility that you're at, but you're taking the patient a mile away, that still would be considered a close facility. Think of it like a radius. If people from that area leaving that hospital would normally go to that new facility, it's considered close. The only time they wouldn't be going to the closest appropriate is if they're transferring for some type of care that can't be gotten somewhere else. The next part, if it's a hospital to hospital, describe the services needed at the second facility, not at the first. This would be our higher level of care. What does that patient require that they can't receive where they're at? And then the last one here in this section, if it's a hospice patient, is the transport related to their terminal illness? Yes or no? The best way to think of this is, say you're taking a patient out of the hospital. Their hospice diagnosis is lung cancer. If they were in the hospital for some type of respiratory issue, it's pretty safe to say it was related to the terminal illness. If the patient was in the hospital for a hip fracture, it's pretty safe to say that that was not related to their terminal illness. And then on the line beside it where it says describe, that is where we expect you to write what their actual hospice diagnosis is. So you could just write DX, whatever the hospice diagnosis is.
Remember, when completing Section 1, the following areas are mandatory: the patient name, date of transport, insurance or Medicare number, pickup location, and destination. The other boxes are optional.
Section 2. This is the middle portion of this form. This is to be filled out by whoever signs the form at the bottom. The first, number 1, is where they describe the medical condition at the time of transport that requires the patient to be transported by ambulance. They can fill out whatever they want in this part. They can put weakness, bed confined, non-ambulatory, altered mental status, whatever it may be that would support why that patient requires to go by ambulance. Number 2, they ask, is the patient bed confined as defined below? Yes or no? And it's the same exact definition that I gave you when we went over mobility. Number 3, they kind of double down. They say, can this patient safely be transported by a car or wheelchair van? May safely sit during transport without an attendant or monitoring, yes or no? So they need to answer that. And then number 4 gives them a ton of selections where all they have to do is check the box that correlates with the patient. And it gives them a ton of reasons why that patient would require ambulance transport rather than going some other way. Section 3 is where they're going to sign. What we need in this section, we need a signature, a clear printed name with their credentials, and then we need them to mark the day that they sign the form. And at the bottom, we need them to check the credentials that correlate with their name. Now, a few things I have to mention on this. When I say a clear printed name, it needs to be clear enough that we can actually read what their name is, because sometimes we have to go out to the state of Florida website and actually pull the verification to show who this person is. So we need to be able to read their name. The other thing that sometimes is a little tricky, the date signed. As long as the date signed is filled out and the transport date at the top is correct, the date that they sign this form, it's okay if there's a couple days in between there, as long as it's prior to the transport. Now, the transport date in section 1 has to be correct for the day of transport, but this form can be signed prior to transport. The reason that this happens, say you have a social worker who might be getting paperwork together for a patient knowing that they're going to be discharged, but they don't know if they'll be there to fill out the paperwork. So they might sign this form and have it completely filled out, but have the transport date for the day that the patient actually is going. As long as it's within a couple days of the transport, no issue. Now, if you see that it was signed like a week prior or any more than that, I would question it. Also, if you're in section 2 looking at it and things don't line up with what the condition of the patient is, I would ask for another PCS form to be filled out. Now, the last thing I have to mention with PCS is there are certain signer requirements. So the only people that can sign this form are a physician assistant, a nurse practitioner, clinical nurse specialist, registered nurse, LPN, social worker, case manager, or a discharge planner. They're all listed at the bottom of the form, so you don't have to remember every single one of them. The other thing I have to mention with PCSs, the reason that these are so important, there are insurance companies, including Medicare, who require that we have this on all of our non-emergency transports. So, if we don't obtain this form, there is a process we have to go through. We have to send a certified letter to the patient's primary care doctor. After the time of transport, the only person that can fill this form out is the primary care doctor. We send them a certified letter. We hope that they send a form back to us filled out and that it's filled out correctly. If they do not, we have to hold that insurance claim for 21 days before we're allowed to bill it, and we have to bill it letting them know that we did not obtain the correct paperwork. If you think about it, say there's 5 of these a day that we forget to get, or we get filled out, but it may be filled out incorrectly. At the end of the week, we have a whole stack of claims that we're not allowed to bill and that we have to hold for 21 days to bill them. It adds up just because of a piece of paper.
Please remember, Section 2 must be completed by the person signing Section 3. Section 2 cannot be completed by an EMT or a paramedic. The number one reason for PCS forms to be returned to EMTs and paramedics is that Section 3 is not completed properly. Section 3 must be signed, the name legibly printed along with the credentials, and dated. The credentials must also be checked in the appropriate box at the bottom. We now hope you have a better understanding of the proper completion of a Physician Certification Statement, or PCS form. If you ever have any questions, please feel free to reach out to a supervisor, a manager, or the QA department. Thank you for your attention.